Today what we're going to work on is fitting an orthodontic band on a molar. The bands come in many sizes, and you have to find the size to fit the tooth, exactly like you'd have to find a pair of shoes to fit your foot. One of the things that you have to realize that each tooth is shaped a little bit differently, and so once you get a band that is fairly close, you have to contour the band. What we're going to do is we're going to use this band here today. We're going to put it on the tooth, and then we will contour it, we will remove it, and then we will cement it. Okay? One of the things that I do when I put the band in the mouth is I hold it, and I know it's going to be hard for the camera, but I push it down with my thumb between the contacts. Once it gets between the contacts, then I'm going to use a band file, and I'm going to push it down between the mesial and the distal of the tooth. Once I get the band down on the tooth where I want it, and if you want to, you can use the bite stick, and you could put that on the inside and then have the patient bite down on the bite stick. Put it on the outside, have the patient bite down on the bite stick, and that will give you a little bit more force without slipping. Once you get the band on the tooth, what you want to do is come in to the mesial groove, and you want to contour that band in like that. Come into the lingual, contour the band in, and then interproximal, if necessary, you want to make sure. So when you look down on the band, it is gone from the shape of the band that was made to more of the shape of the tooth. So it fits those little grooves, so you won't have open margins when you cement the band. So usually you don't have to worry about the base of the tooth, but it's always good to make sure that your contacts interproximal are pretty tightly fit. Okay? Then when we take the band off, using a posterior band remover, you're going to grab the band, and again, I apologize, but you're going to grab the band, use the tooth as a leverage point, and use the tooth as a leverage point on the inside, and be able to take the band off between the contact.